I think it's about the changing doctor training, that health communication skills is about having 2 ears and 1 mouth. And again, I mentioned it in there as a creationist, dare I say, maybe there's a hint there that we should be using them in that proportion. I was talking earlier about the fact that evidence begins to show that if a patient on a GP visit can speak for 1 minute uninterrupted, they will actually get to often the main issue they're there. But GPs with the best will in the world will interrupt after 18 seconds. And I'm not having a go at GPs, it's true of all of us who have a solution for somebody who has a problem. We'd want to jump in and help because we're caring people. But it's that idea of holding back. I think the other thing we need to look at is motivational interviewing and how we begin to train GPs, but also train patients. And I went to see my GP the other day and we did a simulation motivational interviewing technique, and I came in and she said, so Mark, what are your life goals? And I was like, oh, shut up, just give me a prescription for metformin. So unless I'm ready for that different engagement, and we've trained all the doctors and we haven't trained the patients, it's still not going to be a good conversation. Which brings me then to patients. Patients have to stop being passive. It's very much around taking that information. If you don't understand it, talking to people who can help you, even taking in an advocate with you into consultations. And I do the same with my mother, and somebody who can help support you. I mean, I have diabetes. When we talk about diabetes, and I heard it for the first time, I didn't hear anything for 3 months. I couldn't hear anything, it took me 3 months to get over that. And then I began to want information that was personalised to me. So we need to just change the conversation, be honest. We keep playing these games, so thanks doctor, but I'm not going to take that medicine, so don't prescribe it for me. Or could you really explain to me the benefits of a statin? What are the numbers required to treat? Etc., etc. Let's just stop kidding on and let's listen to each other and let's be more honest. I think it goes back to the paradigm shift of thinking of information as a therapy. So I would not give a dose of an antibiotic to somebody, if I didn't know their body mass index, if I didn't know their renal function, their liver function, any other drugs they're on. Why would I give somebody a leaflet, a digital health app, anything, without knowing something about their level of health literacy, their ability to digest information, how much they want? We need to have these conversations about health beliefs and medicine's beliefs, about their level of motivation. A lot of the health psychology stuff is just missing in terms of healthcare. Without understanding your punter, your end consumer, you can't deliver a tailored service. So we need to think, if information is a therapy, let's begin to get some parameters that we can measure and we can use in order to tailor that delivery.